Are you committing one of the 7 deadly sins of psychotherapy? If you're a therapist, counselor, or mental health professional, listen up, because in this series, we're diving deep into the biggest mistakes of psychotherapy and how to fix them. Welcome to the 7 deadly sins of psychotherapy. In this series, we've discussed the modern mistakes of professional mental health with the hope that together we can identify better practices and improve the outcomes and reputation of the psychotherapy discipline. The 7th deadly sin of psychotherapy has led to professional discouragement, insurance companies interfering with treatment, and worst of all, therapists being ineffective with their patients. The 7th deadly sin is silenced secrets. Nearly 100 years ago, a groundbreaking study was done by Saul Rosenwig to determine which approach of psychotherapy was the best. Rosenwig discovered that therapy was extremely effective. However, no particular treatment approach or method was superior to any other. The implication of Rosenwig's discovery was that the treatments weren't responsible for therapy outcomes. Instead, something about the therapists themselves was resulting in patient success. In fact, Rosenwig noted that some therapists were significantly better than others, but the reason behind this success remained a secret. 9 decades of research confirmed Rosenwig's initial results, and also revealed that the best therapists didn't owe their success to training, education, treatment methods, or even professional experience. The secret of success, it was discovered, had to do with a set of skills that some therapists have and others do not. This discovery of what makes therapy work is the most important finding in the history of psychotherapy. But stunningly, most therapists have no clue what these secret skills are. So if we know the secrets of the best therapists, why aren't we using them? Well, one reason is that they are difficult to teach. Skills aren't exactly a formula a student can learn and then easily do. An example of this might be the difference between learning a song and learning to sing. Anybody can teach you the words to a song, but that doesn't make you a singer. In the same way, many graduate school faculty are not experienced clinicians, so despite knowing about the secret skills, they likely have not mastered them. Another reason therapists don't know about the secrets is that the healthcare system doesn't care. The American healthcare system functions a lot like a vending machine. Insurances pay providers to dispense treatments, medicines, procedures, or actions without caring much about how skilled the provider is. Insurances just want you to use cognitive behavioral therapy, even though a century of evidence proves that skilled therapists will outperform a specific treatment every time. In this way, mental health is less like a vending machine and more like a gourmet restaurant. If the chef isn't good, the food isn't either, regardless of the ingredients they have in the kitchen. So we understand why psychotherapy fails to embrace the secrets of the best therapists. But why does any of this matter? Well, first, bad therapists hurt patients. There's long been a myth that even a bad therapist is better than no therapist at all. In a profession without enough professionals, we'd rather a person get therapy than stay on the waiting list. But in reality, the science tells us that bad therapists aren't just ineffective. They actually worsen the patient to the point where it would have been better if therapy never happened at all. Our profession's lack of training in the skills of successful therapists directly results in bad therapists harming patients, which violates the Hippocratic Oath and is morally unacceptable. Second, the best therapists are way better than you realize. In studies that ranked therapists based on patient outcomes, it was discovered that therapists who mastered the skills were 8 times more effective than average therapists. If that wasn't already amazing, those therapists achieved meaningful results in less than 3 sessions on average. To help you visualize that success gap, imagine a race where the average therapists are represented by the fastest man alive, Mr. Usain Bolt, who runs at a speed of 27 miles per hour. The best therapist in comparison would be represented by a Grand Prix Formula One race car, which cruises at a screaming 200 miles per hour. We could all be that race car if only our profession focused on training the mastery of the skills of the best therapists. So how can you learn the secret skills of the best therapists? Well, first, you should know that the skills are actually known as the common factors, and there are plenty of books and research exploring the factors, but I recommend Effective Psychotherapists: Clinical Skills That Improve Client Outcomes by Miller and Moyers. Second, you should rehearse each skill with careful self-examination and intention. An effective method to help with this is called deliberate practice. Lastly, remember that the secret to great therapy is the therapist. The methods, interventions, and theories we use are like ingredients in your kitchen, but you are the chef who brings them all together to make something nutritious. Throughout this series, we've explored the 7 deadly sins to improve this vital profession for our patients and communities. I hope that you joined me with a curious and open mind, and that this series challenged you to discuss with your colleagues how we can all improve. I'm Dr. Jim, the Sin City Shrink. Thanks for watching, and I hope you'll join me for more conversations in the future.